Supervisor Robinson. I'll call the Wednesday, April 3rd Health and Human Services Committee meeting to order. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We will move on to public comment. We have many visitors today. Has anybody signed up for public comment? No? Okay, great. And anyone who's here today, if you are interested in participating in this conversation, we're going to have probably more of a little informal meeting than we normally do, so feel free to come sit at the table, and we have microphones if you have questions or comments you want to make today. Move on to item 4, approval of the March 6, 2024 Health and Human Services Committee meeting minutes. Those are in your packet. Motion by Arstead, second by Gonering. Are there any discussions, changes? Right, seeing none, all those in favor say aye. Aye.
Aye.
Opposed? Right, none opposed, motion carries, thank you. That brings us to item 7 today, educational presentations and committee discussion. Presentation and discussion on the challenges and opportunities related to serving the unhoused population in Marathon County. So we have a few, now you're behind me. We have a few visitors with us today. We have the mayor and chief of the city of Wausau, who was hoping to talk to us county folks about this situation happening. Lance, I don't know if there's anything you want to add before we get started on the conversation. Otherwise, I'll pass it off to the chief. All right?
Okay, well, I'm not the chief, but I'm going to pass it off to him because he's going to have a lot more to say. You always do. So we've been having this conversation over the last, I don't know, maybe 6 years, 7 years about homelessness in Wausau. And it's increased quite a bit. You probably see it a lot more around here. You see it downtown, and you see it maybe in the river area, maybe in some of the parks. So folks want to address getting people off the streets, making sure they have treatment, making sure that they have case management. And so we have assembled a task force through United Way, where they've been meeting before I got here. So I don't know, 2019 maybe they started, and have really robust and good conversations about the kinds of things we need to do to address. And one of the components that we've heard over and over again, especially when we bring forward concepts to our city council, is that where the heck's the county? They're asking how the county is participating with support, things like case management and maybe social services. And so I guess that's why we're here. We want to talk to you a little bit about what the kind of lay of the land is, but also kind of start this dialogue about how the city and the county can work together, but also other municipalities, because you're probably going to hear a little bit about some municipalities that have been kind of, I wouldn't say they're working with us, but they definitely are aware of the services we offer in the city. So I'm going to pass it over to the chief. He's got more of the lay of the land for you.
Well, first off, thanks for having us here. We don't pass up any opportunity to try and educate the community or other partners on the challenges that we're seeing. And I'll start by just sharing with you the same thing I've shared with our city council, which is we have a major issue. That issue is lowering the quality of life, at least in Wausau right now, but I think in some surrounding communities as well. Specifically in Wausau, it has to do with our ability to develop our downtown for our business district, the impact on them, the library, the parks. Every time we create a rule in a city park, Jamie Polly comes to me and says, well, how is this going to impact the county parks? So there are areas that I think we're connected, and I think that the success of the city of Wausau directly impacts our surrounding municipalities and the health of this county as a whole. And the quality of life here is going down. The ability for Wausau to have people interested in having offices or businesses in our downtown is definitely impacted. And one of the main reasons for that, it's an asset of the city, but it is also proving to be a detriment right now. And that is that the city owns 3 parking ramps. And as you see the Children's Imaginarium going up and you see all the plans for what's going to occur on the mall property, as well as the different office buildings down there, everybody drives there, and most people own a vehicle. So where do they park? And so we have those parking ramps. Unfortunately, those parking ramps are also not necessarily a safe or quality place to be right now due to the number of unhoused individuals utilizing those ramps as shelter or as places to be. It's not necessarily just that there's someone in those ramps or that there are people in the library. It is the behaviors that they're demonstrating while they're in there. And, you know, I invite the community or anyone else to come to my office and I'll push play. I'm the bad guy when I bring the video for you to show you over the last 2 weeks the different types of behaviors that are occurring, but they involve sex acts, they involve crimes that involve knives, they involve firearms, they involve defecation and urination, all in our public properties. And it's easy for us in the parking ramps because we have surveillance cameras. But we're well aware that those exact same behaviors are occurring in our parks, they're occurring in the library, they're occurring in all these public spaces. And it's those behaviors that are a detriment to any growth, economic growth or development, or having people utilize our downtown the way in which we see growth and the opportunities there. So I'll talk to you about this through a couple different lenses. One is, what do we currently have that we're using to address that? And many people hear of the name Tracy Rieger. She's our community outreach specialist. The city of Wausau is funding that through levy dollars moving forward, but they utilized ARPA dollars to bring her on board at our request. And she spends all day, every day, working with the homeless population to try and get them housed, try and get them to resources. Those challenges can be as simple as getting someone to the DMV because they don't have an ID. If you don't have an ID, you're very limited in what you can do. It's getting people signed up for insurance. It's getting them to doctor's appointments when they have issues. And then including housing, she's housed 40 or 50 people. The challenge with that is that we also see that getting someone housed has proven to be the easiest component for this population of individuals. Keeping them housed is much, much more difficult. And due to the fact that many of them, due to the chronic homelessness that they had found themselves in and they become housed, they do not have the skills necessary to function appropriately that allows a landlord to keep them housed. And we're burning bridges with different landlords in this community as we ask them to help this population, and then they end up losing thousands of dollars in damage. And what Tracy found was, well, if she housed someone and she went and spent 3 or 4 hours a day with them, it kept them functioning appropriately to stay housed. But she's not capable of spending 3 to 4 hours a day with every individual that she's trying to help. So we see limitations there. From a police department standpoint, we do our best to enforce the laws and ordinances and the standards of our community. The frequency at which we're being called, and in order to try and do that, we're limiting the actual law enforcement that's occurring in our neighborhoods for those individuals that are paying the property taxes to have police services. So what we are in the process of doing right now is asking our city to authorize us to hire 2 additional officers, which would be a team that focuses on quality of life issues, specifically in our downtown and in our parks and in the library, because we know that when Sheriff Billups in the room, so is Laura Scuderi, and between the 3 of us, we came up with the CART program and instituted that, where if we can take officers and partner them with professionals and have them focus all of their time on a specific issue, we get much better outcomes. And so I'm very confident that if we have 2 officers who are a team and are assigned to the behaviors that are occurring in our downtown, mostly with our unhoused population, that I would expect we see better behavior as a result of that. There's consequences to that because people are going to go to jail. More people are going to be caught breaking the law. Our expectations aren't going to be flexible. And so that's required partnership with the county, specifically through Sheriff Billup, looking at what the impact on the jail might be when it comes to that. That's what we can do. And the challenge is, I look at where we're at currently from a population standpoint, and we have seen over the last 3 months a dramatic increase in the number of unhoused individuals in our community. And that unhoused population are not from Wausau or Marathon County. They don't have ties to this community by their own acknowledgement when they're showing up for services, when our officers are interviewing them or dealing with them on the street. And so I can only give you an educated guess on why that would be in our community, but we need to do something here to stem the flow or the migration of homeless individuals to our community because our resources are finite. We don't have the ability to just expand them as that population expands. And as that population expands, we're really watering down the effectiveness of our resources for that population. So we've done a lot of research on what are other communities doing, what has proven to be successful. And because nothing the police department's going to do is going to solve homelessness in this community. But what we have seen, and there's no blueprint. If someone wrote the book that I just had to go, even if it was an expensive book, I'd read it and we'd do that. So that doesn't exist. But we have seen communities that have reduced their unhoused population. They have worked close to achieve what's a functional zero. And you might hear functional zero in the conversations about homelessness. And that's basically that you're managing your homeless population and you're allowing people that enter homelessness to leave at the same rate that more people are entering homeless. So there's no net growth. And so what are the things that those communities have done that have proven successful? First and foremost is a philosophy that all services provided and funded by any government entity have to fall in the lane of empowering people to leave homelessness. If those services fall into the category of enabling people to live in homelessness, then they don't belong as part of that community, and they don't belong being funded. That's a challenge we face. Really big-hearted, great people that believe they're doing well. They're handing out tents and sleeping bags for people to go camp in our parks. We remove the encampments from our parks. Your parks department, our shared parks department do that. Our DPW does that. And then they just go get handed more sleeping bags and tents, and it's Groundhog Day for us in regards to that. And so I believe in my heart that not enabling people forces them to resources, or it forces them to find a community that's more tolerant of their behaviors. So between the appropriate resources and an enforcement that has a zero tolerance for violating our standards, that will cause some people to leave our community because they'll say this isn't the place to be. Marathon County's not the place to be. I should go find somewhere that allows us to do that. And what's also very unpopular with some members of our community is the belief that if the city of Wausau is funding, the taxpayers of Wausau are funding resources and individuals are donating from our community to our nonprofit organizations that are serving the homeless community, that those services should be for our population that enter homelessness. It shouldn't be all those services open to whoever wants to come here to receive those services because they might be better than where they have been. And I think we see some of that right now when we see this net increase in people with no ties to our community arriving here. And so everyone asks, how do they get here? And many of them have vehicles. Many of them have people that care about them and the community they're in. They've burned bridges at that point. They've used up what's available for them. So a family member might say, let me take you somewhere else where you can try and utilize those resources and improve your situation. We have other police departments that have dropped off. One specific example that shocks my conscience a little bit is another police department that dropped off an unmedicated, homeless, schizophrenic woman at 1:30 in the morning at the Quick Trip on Grand Avenue, and then beat feet as quick as they could out of our community. Like, that's not acceptable. We don't do that to other communities. I think it's inappropriate for them to do it to ours. But I understand there's these challenges that everybody's dealing with, and they're trying to find a place to to send people. Aspirus Hospital is a trauma hospital. We had Stevens Point Police Department's a great partner of ours. They are struggling with homeless issues the same as we are. 2 homeless individuals in their library. One stabs the other one. They get an ambulance. The one that got stabbed gets an ambulance ride to Aspirus Hospital. They treat that individual, and when they're ready to be released, they're released into homelessness in Wausau. +1. And so that challenge, we ended up getting that individual back to where their resources were in Stevens Point, where they wanted to be. But it is taking a lot of work. We've had individuals who, from far northern counties that really have no connection to us, that their law enforcement has someone that's in crisis. And they say, and that individual says, I want to go to North Central Healthcare. So they get driven all the way down here from a way northern county. And then when they get here, they say, well, I don't want to go there now. And so they let them out of the car. +1. We have example after example of lots of different ways in which individuals are arriving in Wausau, some that have absolutely nothing to do with government entities, and some that definitely have something to do with government entities. And it's a challenge. When communities don't have any resources, they end up with homeless individuals, they try and find, well, where's the closest place we can do that? And it's not going away. So again, nothing I'm talking about is a solution to homelessness. What are some of those root causes? And I'm going to give you my opinion after researching this. There's 3 things that are really impacting homelessness that if we could solve these here, we would limit who's available to these resources, we could really make a dent in this. And one is AODA resources that are available, accessible, and robust for this population of individuals, which are very, very difficult to serve. The same thing true with mental health resources, that they're available, robust, and accessible to this very challenging population. And the last one is affordable housing. And we know from the most recent housing study that was done in Marathon County that we're short about 5,000 units of housing. What's that? Was I close? 5,000 units of housing. Well, finding housing, even for individuals that aren't unhoused here, is an enormous challenge. And as that supply of housing does not meet demand, it raises the value of that housing. And so we see the price of houses going up and the price of rents often exceeding what a mortgage on a house would cost. And so for lower income individuals in our community, it puts them on a bubble. One incident within their family causes them to find themselves in this situation of homelessness. We have a shelter. It houses 30 individuals. On any given night, we're turning away 10 to 15 people. That's Catholic Charities as part of the CPC. Salvation Army has 18 beds. However, they have changed their philosophy and they are moving to serving 3 families instead of 18 individuals. So just those individuals seeking housing, we're looking at on any given night, 20 to 30 individuals. Last year, Catholic Charities saw 350 unduplicated individuals seek shelter. Approximately 1/3 of those were women. And as we look at what the forecast is for the unhoused population in Wausau, it's bleak. And so these are the concerns that we're bringing forward. And I know that there's a struggle for policymakers in Wausau as Wausau is subsidizing all the other communities in Marathon County when it comes to the unhoused population. And I say it this way, if there's someone that puts an encampment up at Kennedy Park in Weston, where are they going to take that unhoused person? Well, they bring them to Wausau, to the warming center, which is funded with Wausau dollars, not anyone else dollars. And we know we have homeless individuals all over this county, and this issue is expanding. And I don't see a possibility where the city of Wausau can maintain all the resources and continue to fund them without partnership, either with the county or with the other municipalities, or ideally all of the above. All right, that's a lot of talking. hopefully there's a little back and forth.
Thank you. That was very informative and provided us with a lot of context. I appreciate that. Yeah, go ahead.
So, good afternoon, everybody. Just to add some context to what Chief Barnes and Mayor Rosenberg referenced, that task force that United Way has had operating for quite a number of years. I have attended that on behalf of the county, and I know Supervisor Lemmer has relatively recently. I don't know if now is an appropriate time to start talking about what might that transition look like to address the challenges, because I think, as the chief laid out, the challenges are many, they are significant. We actually had the chief as well as Jamie Polly from the Parks Department, the library director, and representative from United Way, and I think the Neighbor's Place as well, came to our staff in-service, because in putting together the agenda for that, we know this, I know, my staff know this is an issue, and we wanted our staff to know more about the challenges, because as one thing I think you'll hear me say, hopefully more in our conversation that's upcoming, this population is, as the chief said, it's more challenging. Delivering mental health services to this population, or AODA services to this population, or any service to this population is just different than if you or I were needing to get those services. All the ancillary challenges that these people, these individuals have in their lives that you or I don't have or may not have, make delivering services to them much more challenging. If you think back to our high school days, Maslow's hierarchy of needs, right? If your foundation isn't met, it's really hard to get up and deal with those other pieces. So I think as we transition to what are the areas, the opportunities to work together, as the chief said, in partnership, I want to start with this piece of knowledge that I think is helpful. We already interface with this population in our various departments in some form or fashion. The Family Keys program was something that was developed through our social services department to address some level of housing instability for families. Again, not always the same population, but North Central Healthcare, as the chief alluded to, they do have services that have on occasion served individuals that fall in this population. Our library is interfacing with these individuals. As the chief said, our Parks, Recreation, and Forestry Department is interacting with them, in addition to all the other city of Wausau departments that are interfacing with them. The other thing is the state of Wisconsin has state departments that interface with these individuals. In this very building, we have agents from the State Department of Corrections. There are homeless individuals that are on supervision through the State Department of Corrections. Our court system, as the chief said, as individuals make their way through court, as that enforcement side of this equation ticks up, they're going to interface with our court system. We have a new deflection program position within the DA's office in partnership with the sheriff's office. That staff person, somewhat similarly to what Tracy does with the police department, is interfacing with that population. The low-hanging fruit from my perspective, and again, I always subscribe to the baseball measure of success, so 1 out of 3 is in the Hall of Fame, so maybe this is the 2 out of 3 that I'm wrong, but it's that we can do it in a more coordinated way. That's the good thing about the United Way task force that we've been having. There's a wide variety of perspectives and backgrounds in that room to have conversations and figure out how to kind of turn the curve here, because as the chief said, that we are seeing this uptick, but it's going to take us doing things differently and communicating more effectively than we have to do that. And the other part that the chief alluded to, there's not some giant, unless you guys know where it is and I just haven't told me, there's not a giant pot of money anywhere for all this to happen. It's not reasonable, as the chief said, for the city of Wausau to continue to, it's not sustainable, I should say, to have the city of Wausau continue to use levy dollars, just like it's not sustainable for the county to continue to allocate a significant amount of levy dollars to these programs without some really clear forethought strategy. So I think coordination is something between the departments that already interface. And then I think I shared this with Chair Gibbs at our most recent National Association of Counties event that was in DC. The first day of the conference, I just selected the presentation to go to, and this was after having a number of meetings with the chief in our housing and homelessness task force, talking about funding. And I walked in, sat down, and the presentation was on how to align programming with Medicaid and HUD dollars to address homelessness. I don't know enough about Medicaid dollars and how to design programs that are specifically tailored to the challenges that this population has, but I think we really need to take a good hard look at doing that. We have not been overly successful with the programs that we have, just to say like, oh, we have an inpatient program or we have outpatient counseling through North Central. It's entirely feasible for them to serve the homeless population. Well, the homeless population isn't going to, as the chief said, it's not accessible necessarily to them. Just like a lot of our programs in our justice system, we need to make special, we need to design them specifically to address some of those concerns and issues that those individuals have. So I think taking some time, not only to say how can we do it better and communicate better right now, but also concurrently really sit down and look like, if we want to align the delivery of these services, let's align them to a funding stream that is something other than ARPA dollars, which have to be allocated at least by the end of this year and spent by the end of 2026. That's not sustainable. Let's align them to a funding stream that is, because it's really hard to address a challenge. In my experience, it's really hard to address a challenge when half of your time is spent running around chasing where the next dollar to solve it is going to come from. But I just want to say I do think certainly it's good that we're having this conversation because I think the ancillary impacts that Wausau is seeing, we're seeing as well. I mean, we've had Chad and I just met with Sheriff Billup and I just met with Leah Giordano a couple of weeks ago to talk about some of the concerns. We did a small capital project at the library earlier. Well, that would have been, I think, last year, to just fence in some areas underneath their building because there were areas where staff did not feel safe. So there's a lot of things we need to do. We just need to, it's good that we're continuing to have that conversation, and we need to have more of them.
Can I just add, like, when we think about what do these services look like, I'll give you this analogy. Let's say we want everyone to drive and have transportation. If we just give them a car and we don't teach them how to drive, they're going to crash. We're going to see a lot of crashes. And so it's that transitional housing component where AODA and mental health resources can be given to them, life skills, while they're also housed at the same time. And we're definitely finding that just providing the housing is a recipe for failure, and it's just Groundhog Day. We're just having that individual leave homelessness. So that type of process where there's oversight and regular and constant and potentially 24-hour-a-day case management that exists and oversight of that housing is really what I think is the path that creates steps for individuals to achieve a little bit, learn, achieve. Then there might be less oversight or a different resource that's necessary becomes available to them. Just sending people to a provider and expecting them to improve has just not proven to be effective.
And love the analogy, by the way. We've done that in the past, and like the chief said with CART, very similar situation with our treatment courts, right? Like when we have individuals that are, if we think back to what had been our OWI court, individuals that had such persistent and significant substance abuse needs, and we just said, well, here's your next treatment appointment. Here's the stuff you need to do to get to move through your case, they're not going to be successful. They have other things in their way that prevent them from availing themselves of the treatment and education that they're going to need. I like your analogy of the car. Yeah, maybe they'll drive for, I don't mean how many miles you can get out of one tank of gas, but then they're out of gas too. Maybe they can avoid the crash even though they don't know how to drive, but they're going to run out of gas without the job to fill the tank, to do all the things you need to do. So it's going to take a lot of forethought, and I haven't done as much research certainly as the chief has, but if anybody had an answer, we would rip off and duplicate that thing as quickly as possible. I don't know that there's hey, let's take that and just apply it. It's going to be a lot of tailoring the program to what we have and how we need to have it work here.
Lance, you talked about going to that conference, and in your experience, do you know what other counties or communities are doing around the state or country?
I would defer. I know the mayor and the chief have some examples of what's happening in the state of Wisconsin, and I know La Crosse has had some similar challenges, and I know Chad has had some conversations with La Crosse law enforcement. As it relates to the conference that I attended, there were some pilot programs happening in other states. I need to do some additional research, and I reached out to Krista, and I'm going to also talk with Vicki from North Central we need people that understand the Medicaid funding side. As you know, Wisconsin is not a Medicaid expansion state under the Affordable Care Act. I believe a lot of the states that were referenced in the presentation were Medicaid expansion states, and we're using what are referred to as, I believe it's 1115 D pilot program dollars to implement some of those strategies. But the presentation, again, talked about aligning with Medicaid and HUD dollars, and we do have a fair amount of HUD dollars, housing and urban development dollars, coming into Marathon County and specifically into the city of Wausau, but also with North Central CAP. How do we, again, going back to the Family Keys project with North Central Healthcare, we really utilize North Central CAP services to address some of those housing specific needs. But to the chief's point about making sure that there's an accountability side to that, to whatever solution we put in place, I think is extremely important. That is also consistent with what we've seen in those other programs where that's worked, like our treatment courts or with our Family Keys program, where there is a requirement. There's that significant oversight, but requirement that people are doing the education, that they're getting the education that they need to, as it relates to Family Keys, to know how to manage your money, to set it aside, to make your rent payments, to know how to review leases. I mean, that's much higher level than what we're talking about when whatever we build is going to need to be started. But I think that's where we need to perhaps not start, but concurrent tracks. Again, it's like we need to figure out how we can just do better with what we're doing right now, but also how do you set up a program through a collaboration that is sustainable. But I'll defer to you guys on
Yeah,
that.
I'm going to give this over to Matt in a second. But I had an interesting experience, actually, we both did, where I kind of serendipitously ran into the executive director of the White House Intergovernmental Council on Homelessness. That's a thing. And basically they pull in many folks from the president's cabinet to kind of converse about how do we address homelessness. And right now the administration's goal is to cut homelessness by 25%. And so we actually had one of those folks from that council in Wausau, and we showed them CPC and all of that stuff. And she really focused on housing first, and that was like the first message out of her mouth. But then we had Bridge Street Mission had brought in a speaker, and it was the Trump administration's executive director of the same council. And he also focused on this housing first, but he said, it's never going to work unless you do treatment. And I know that he is now the chief's BFF. They're talking all the time about how to address these issues. But it's been really important to talk to these folks who are seeing it across the country. You know, I know everyone points out to Houston about why that's a good model, or, you know, why we don't want to turn into Seattle, things like that. But I know that you have more to say about all of these things.
Well, we've definitely seen communities in Wisconsin experiment with stuff that turned out to be an epic failure. Like La Crosse would be one of that. I think they'd acknowledged that. They gave up a park and said, here, put your encampments here. My understanding is they had to bring bulldozers in and front end loaders and remove the topsoil from that park because it was so contaminated within a year. And right now there's encampments all along the beautiful Mississippi River in La Crosse, and they're struggling with that population growth. Somewhat because I would argue they allowed behaviors that aren't consistent with the standards of their community to exist. And there was a lack of enforcement based on someone's housing status. And I don't plan on making that same mistake here. But when the Trump administration's guy, not Biden's guy came, like they were able to provide us a list of, he said, hey, you know what you need to do is get your frequent flyer miles. And he gave me 20 different places that we should go check out. But the thing that is consistent with them is they have housing opportunities. They have transitional housing. It's Housing First wasn't just give people a place to live and meet that need. It was give them a place to live, but have the resources so that they can be successful doing that. Because one is not effective without the other. We can give treatment to people, but if they're unhoused, they're not going to be successful. And if we house them without the treatment and the oversight and the case management, they're not going to be successful. The communities that have seen a reduction in homelessness are as a result of hard decisions that are a little bit selfish for their community. They're saying our services are for our community, and if someone arrives here, we will help facilitate them getting back to a community that they have ties to. So they have resources that are kind of case managed for that population of people that go to door number 2, which is, this is not the place for you. These resources aren't for you. Here's enough to get you by as we work with you to get you to a place you're more likely to be successful. I mean, he was able to provide the research that says that you are statistically far more likely to achieve success in your AODA recovery, in your mental health recovery, or in your ability to leave homelessness if you are trying to achieve those things in a community that you have ties to, a community you're familiar with, as opposed to showing up to a new community and doing that. So those are some of the things that we're definitely seeing. And he was very clear about the role of law enforcement in that process and having zero tolerance for behaviors that negatively impact the quality of life and your economic growth within your community, because those are the things that are helping to fund the things that you need to do to be able to address these, and them all being related. So I think there's a lot of research to do. Our deputy chief, Todd Baton, was just in Salt Lake City. I wish I could say I sent him there on a fact-finding mission, but he was checking on his kids who live out there. And he said, Matt, I used to live in Salt Lake City. They've always had a homeless issue, and they still do. There, it's a population of 200,000, and then they're surrounded by other municipalities, and they estimate their unhoused population to be 3,000. He said, as we're driving all over downtown Salt Lake City, I can count on one finger the number of individuals I would look at and say, now there's an unhoused individual. So next thing you do is, what are they doing that we're not? And it's a couple of things. One is, in researching all of the communities that surround Salt Lake City and Salt Lake City proper are financial partners in the services that are available there. They have two shelters that each house about 200 people. And it sounds like 3,000 is a lot, but if you scale it to Wausau with a population of 40,000 and our 350, it's comparable. And then law enforcement, which we were focusing on. So they have these services, they have shelters, they have many of the same things we have. I think they have more robust access to mental health care and AODA, but anyone that thinks our housing's expensive, go to Salt Lake City and you realize it's pretty cheap to live here. But they also spun up 2 teams of law enforcement officers that work a sector that's 5 blocks surrounding each of their homeless shelters. And they have a zero tolerance, but in addition to zero tolerance, they do all sorts of programming, which is to partner with that community to have their officers be a conduit to resources. That if somebody ends up incarcerated, there's an opportunity. So they have access to resources within their jail to take every opportunity you have with those individuals to help them improve their situation. So when I look at that model, it makes sense to me. And in the 8 months that that has been in existence, they've seen, and now the police department's measuring it not in the number of homeless, but they're measuring it in the amount of crime they were seeing in these areas. And they've seen dramatic reductions in violent crime. They've seen dramatic reductions in drug use and drug crimes, dealing and using in those areas. So it's everything that's happening is an experiment. But it definitely looks like that's a model that I think might be able to be scaled down to our area, that demonstrates partnership from everyone in the community, not just one municipality, the development of robust resources and appropriate use of law enforcement as part of the solution, because we're just one spoke in that wheel.
Just one more ask maybe that we can touch on before we go to conversation and questions from others. If those of you who participated in the policing task force, is that what it was called, John? Just want to touch on some of the findings from that you came probably a couple years ago now to this committee and reported on. Sorry to put you on the spot.
No, thank you. And for those that are new to it, the mayor appointed a policing task force to look at a number of issues relating to policing practices and policies. And we spent a lot of time on that task force, which I had the opportunity to chair, looking at the unmet needs or the health and social service needs in the community, looking at different policies. We invited the DA's office in, the sheriff's office in, a number of other people, North Central Healthcare, to talk about various things. And, you know, we developed a number of recommendations, and one of those was the expansion of the crisis assessment response team. And if you go back historically, that team was created after there were concerns at North Central Healthcare and in the sheriff's department that their top the people that are at the top of their list relative to demanding services, crisis services or jail services, were the same people. And that it made sense to try to intervene earlier. And therefore, the crisis assessment response team, law enforcement, and healthcare workers were put together to go out and respond to people. And there was success in that. One of the recommendations was to expand that beyond an 8 to 5 Monday through Friday service into evenings and weekends, and that's there. But one of the other important recommendations was dealing with the taking a dedicated officer dedicated to homelessness and change that into a social worker to try to meet with some of those needs. And the homeless don't have a mailing address. They don't necessarily, they're not easy to contact relative to follow up with appointments and others. And this person would do some of that, and there's an unmet need. And I think through the success of that program is that hopefully people are presenting less often to law enforcement and or others. But another important component of the recommendations was for active case management. To make sure that you can work with these people on an ongoing basis and avoid them recidivating or showing up at the crisis center and other things. Unfortunately, due to constraints at the healthcare center coming out of the pandemic and others, not many of the recommendations have been implemented, but I think that there is a need for those expanded AOTA services, those expanded mental health services. And probably the issue before the county is, what's the path forward, and how do we look at our role in engaging them? You know, what the Wausau Police Department is facing has an impact on the county, because if they're arrested, they wind up in our jail. And there's a demand for services, and we don't have the capacity to deal with it. But I think that there were opportunities that were identified, and hopefully we can begin a discussion on how we might implement some of those policies going forward.
Thank you. Before we open it up to questions, was there anything else anyone wanted to add? Okay. What questions or comments does the group have?
Okay.
Supervisor
I have
Gunning.
actually two questions. What is the approximate population of the homeless in the Wausau area? And then are they offered shelter during the cold weather?
You're going to get my scientific, wild guess, because I don't think there's any way. We do point-in-time counts twice a year. I can tell you I'm highly critical of them because it is not reflective of what we know the homeless population to be. But what I can say is people go in and out of homelessness. So someone can be living on the street for a couple weeks and then they find someone that's willing to let them sleep on their couch for a couple weeks. So in 2023, roughly 350 people showed up at the warming center seeking shelter, and we had 365 shelter then. And that's unduplicated people. If you were to ask me to guess based on what we see on an every night basis, and if we include those individuals seeking shelter at the Salvation Army and at Catholic Charities that are actually sheltered on a nightly basis, my guess would be somewhere between 100 and 150 people on any given night. A year ago, I would have guessed 75, 80. We know that federally, the anticipated growth of the homeless population in the United States is to double within the next 5 years, and we're doubling in much less time than that, and that's a challenge we're trying to anticipate. So, right, and so when major weather, whether it's extreme heat or extreme cold, exists, the Housing Task Force that Lance was referencing before had members that really did some great work, and they created a community on call, which is when it's forecast to be 15 degrees below zero with the wind chill, that Catholic Charities expands their bed space, and we have members of the community, sometimes those are churches. One day we didn't have anyone, and I opened up the police department, and we put cots in there, and we provide shelter so that we don't have people freezing to death, because that's unacceptable to us. So that program still needs some work, but it has proven to be effective, and it just really helped us that I think we're all aware of. We had a mild winter, and so it wasn't necessary as often as we were prepared for.
There's always it's cruel to say, but if you're too good to the people, come to WASA, we'll take care of you. So you don't want to be careful that way too.
Well, I think that everyone's critical of most of the things I do, so I'm willing to say this, that it shouldn't be comfortable to be homeless, right? And so part of people's motivation to improve where they're at, and I just struggle with the idea that by not enforcing laws and not holding people accountable and providing them services where they are in the form of food, blankets, sleeping bags, and tents, that does not create a desire for many of these individuals to seek resources. None of the resources that exist in WASA allow you to shoot up methamphetamine or heroin or be so intoxicated that you can't function. And so many individuals are choosing to not avail themselves of resources because that's a priority to them. And so finding balance while maintaining your own values, I don't want it to be misunderstood that I care about this population. I want them to get better. Our whole department does. That's the type of people we hire. That's the type of people your sheriff's department hires. And that's really who our community as a whole is, except that finding the balance between accountability and requiring people to help themselves, and how not to make it too comfortable so people aren't willing to help themselves. That's a really hard question to answer. Glad you guys are here to help answer it.
One more question, and I'll shut up. Could most of the people go into the workforce? Are you finding?
Also a very tough question to answer. I would say more than 50% of this population suffer from either AODA-related challenges, addiction issues, mental health issues. More often than not, it's co-occurring disorders with both of those that make it difficult. But are they physically capable of performing work? like I would say yes. Not all, but many of them. And then we also have great partnerships with some of the businesses in our community who acknowledge we're willing to employ people understanding that they have those challenges. So hard to answer, but are there many of them that they're capable of fighting with our officers? So I think they're capable of performing some work at the same time. So it's also a tough part of the challenge.
Supervisor Krause.
Thank you. I've sheltered some of the homeless on different occasions and different people. And what I was wondering was, it's very traumatizing, and it can, to be homeless, and it can cause depression and anger. And the people that you were saying that are carrying knives and guns and acting inappropriately, do you think this is a long-term behavior of theirs? I'm assuming that you might have some information on that with contact with other police departments or the police departments locally here, because I was wondering if it's a long-standing problem for those individuals, then the other people who don't act that way shouldn't be categorized as being behavior problems either. Thank you.
So I would break our homeless population into 3 categories. One is individuals that enter homelessness and they're working really hard, utilizing all the resources to claw their way out of homelessness. We don't deal with them. They're not behaving badly. They're not someone that law enforcement has a lot of contact with. There is a portion of the population that does not want to avail themselves of resources, but also doesn't behave badly. And we don't deal with them either. Other than contacts with social workers and Tracy Rieger, our outreach worker, who are trying to incentivize them to utilize resources. And then there's a portion of that homeless population that does behave badly and has no interest in utilizing resources, and those are the individuals that are lowering the quality of life in our community. And I would agree with you that, yes, if all of us had to spend the night outdoors today and try and survive, we would probably feel traumatized by that and suffer some of those same issues. That's part of the challenge. But what I don't think is appropriate is allowing individuals who are suffering those traumas to use that as a reason to not improve and not utilize resources, or as an excuse to behave badly and expect the community to not enforce their standards. So again, you're correct, and that's a challenge to find balance so that we maintain our humanity as police officers and policymakers and resource providers, but also be able to maintain the standards of our community.
Supervisor
So,
Go ahead.
so directly, were these people that are acting out badly like that, do they have a past record of doing that, or is it just all of a sudden they just explode like that?
Yeah, I don't think anyone just explodes like that. They have a long history. I mean, to be honest with you, I think they have a long history of that might have started with a particular issue where they were traumatized or something occurred in their family, and then they have a long history of really bad life choices and decisions that can be chronicled that result in where they are today and in those behaviors.
I don't know how to say this question, but are there gender specifics? Like, are women more likely to not be able to find places? Men? Is there a problem with that?
So you have all the data, I think, or most of it, but women are definitely more likely to be taken advantage of, trafficking, things like that. It's worse for women. They're much more vulnerable on the street.
I totally agree. One of the things we put together is a partnership with CW Solutions and asked them to develop a program specifically for unhoused women. That's a transitional housing program that includes multiple steps in bringing them back to conform and be a productive member of our community. And the reason we selected women in coming up with that program is because the frequency at which they're being victimized in our community here in Wausau, and that sexually abused, traded, and they're utilized. In order to survive, they're doing things that nobody should have to do in this community. And we also know that the resources available to women in this community are significantly less than available to men. And as a result of that, it made sense to us to develop a pilot program and try and identify what would that program cost per year, how many people could it serve. And like right now, we're in the stage of trying to identify funding. We've applied for congressionally directed spending to be able to help spin up a program like that and fund it. Because if we can find a formula that gets people from the park or the parking ramp to the shelter to transitional housing to 6 to 12 months later, they're employed and they're sober and their mental health is under control and they're caring for themselves. If we find the formula for that, then we can scale that to really have a positive impact here. And so that was our first attempt at doing that, but there's definitely a challenge when it comes. It's much more difficult to be an unhoused woman in this community than an unhoused man, in my opinion.
Go ahead, Supervisor Krause.
Yes, you mentioned quite a lot about people coming from outside the area and being dumped in Wausau, and that you think that Wausau shouldn't have to pay for people from other areas that are homeless. And I was wondering if there's any data or tabulation of, the areas that these people are coming from. And I was wondering that instead of just contacting Marathon County here in general, of going to the different townships and villages and speaking to them about their setting up a shelter for the homeless and people in trouble in their community instead of dumping it all on Wausau. Thank you.
Yeah, that's a lot of meetings. And if that's what it takes, then to get the county to all be partnered together, I think we can accomplish great things if we're all working toward the same goal and we all acknowledge that we all benefit from improvement there. I just want to be clear, are there individuals treating human beings as hot potatoes and dumping them in our community? Yes, there are. Are there individuals that are migrating here because they think this is a better opportunity for them, either from resources or for a place to live? That also exists. And the challenge with data is if we're able to get this team of officers, one of their tasks is going to be to collect data, and we're putting some tools together to be able to have that so we can make better decisions. Because right now it's all based on everyone's experience and who they're talking to. Where are you from? How did you get here? Those might be good questions. But if, you'll see the fire chief is sitting back there, Chief Kopp, and he's in the process of developing a community care paramedic who's going to be out working in the community, working with some of the unhoused population, those high utilizers, in order to reduce emergency room trips and the amount of ambulance rides. Well, at that point in time, if we're trying to make a decision about expansion of that sometime in the future, well, then we want to collect data on how many times have you seen a doctor within last year with a member of the unhoused population? How many times that you got there, did you go there by ambulance and to the emergency room as opposed to using more appropriate resources? And so as we identify different challenges and what those resources might be, we need to have partnership with our service providers, with our shelters, with everyone that's working within that population to be able to share data and have it be data that actually matters to us to be able to make better decisions. And we're absolutely not there right now. I mean, we can measure police responses, arrests, some crime, but our officers within the next year every individual that identifies as an unhoused individual, we're going to be asking them, how long have you been in Wausau? Where were you? Questions about demographics on where were they from? Because we need to start capturing more specific information as opposed to what's available to us. And we also need to work with our providers, which are not government entities, and getting them all whatever they need to be able to come to the table and share their information. so that we know we're not duplicating services for people. We're getting people access to services as efficiently as possible, and we can share each other's data that's being collected to use for the good of the whole and get us all marching in the same direction. And a lot of great people in this community working really hard. I just know that the successful communities have collaborated in a more information sharing and data sharing way.
Supervisor Lemmer.
Thank you, Madam Chair. The new Wisconsin Counties magazine is all about the opioid crisis, and they do talk about Wood County collaborating. So that's fantastic. I recommend everybody reading that. I did also read recently an article from NACO, it's a little older, from 2016, where they have 10 strategies for ending homelessness, and many of these things that you're talking about with data is super important. I don't know that we have anything at the county level. They called it a Homeless Management Information System. It's HMIS, and it really identifies needs at the person level, so that we as a community, when we are trying to collaborate, can be aware of people who are cycling through homelessness, jails, hospitals. They're cross-referenced through either, Medicaid data, the corrections, or ERs. How could we access something like that? And who would be the keeper of that data? For instance, is that a police thing, or is that somebody at social services? I mean, I think we kind of need a gatekeeper to orchestrate the whole thing.
Great question. I think we'd have to figure that out. It's interesting, this idea of data sharing, of course, this isn't going to be surprising, is not new. I saw the sheriff just stepped out, but we had this same conversation with high utilizers a number of years ago between, and I think Supervisor Robinson referenced it, with how can we effectively share information between the county and North Central and the emergency rooms. And I remember Laura, we had to ask for information in a certain order. We could tell Laura, when she used to work at North Central, here's our top 15. I know you can't tell us your top 15, but can you tell us which ones how many are the same? And of the 15, I think it was 7 or 8 were they're high utilizers in terms of inpatient day stays in our jail bed stays or bookings. So I think that idea of how do you share information, and to Matt's point earlier with the community care paramedic, I think it's going to be hard because we all want to make an impact really quickly. But if we want to make long-standing impact, take a breath and really make sure we have the right people at the table. And I do think there's an opportunity, just like the community care paramedic side, and we were talking about high utilizers. I mean, the fact that we have such a robust healthcare system here with their emergency departments, it impacts them. I mean, they are spending dollars, or I should say losing out on dollars, because they're not receiving payment for the services they are providing to this population, or to the high utilizer population we're talking about. That if we can all come to the table and say, hey, what can we all bring to the table to address this? I think the resources are there in a more sustainable way. Like I alluded to before with the city, you only get to spend your ARPA dollars once. It's like birthday money. You don't have a birthday every month, so it's a bad strategy for rent. We need to find those funding sources, and if it is a significant revenue impact for the healthcare systems, my ask of them is going to be at the table, because we're going to be engaging in activity that's going to have costs associated with it, and you are going to be the beneficiary of its success. But that's going to take time. So to your specific question about who would house that, I have no idea. We would need to sit down, and I wrote down, and if I can follow up with you after to make sure I get the right NACO resources. That is a wonderful thing about the National Association of Counties. I know Chair Gibbs has referenced that before. Let's rip off and duplicate wherever possible. There are a lot of communities around the country that are doing innovative things. We just need to, as Chief Barnes referenced, find the right pieces that are going to work here. But I don't know the answer to your question about who would house that database.
I wish there was somebody who worked in housing that was here, because I do believe that there is a database that's used by shelter services and like NCCAP.
Yeah, they do. It's some SPDAT, it's some terms, and yeah, there's an agreement where they can do case conferencing and things like that if they all sign on and agree not to share this information and stuff like that. But yeah, it does exist.
Did you have a follow-up? Okay.
Can I just add that one of the challenges with the different organizations is their funding sources, and it impacts data because depending on what their funding source is, they have different sets of rules, like balance of state rules that are you risk your funding if you do this or if you share this, and so it's kind of along the lines of HIPAA, like it's super. You don't get in any trouble when you don't share anything and you just say HIPAA. I mean, nobody gets in trouble for not sharing something. They only get in trouble for sharing something they're not supposed to. So there are communities that have found effective ways to do that. But that is a challenge we face, and nobody wants to necessarily be the first one at the table sharing information or case conferencing about a specific individual because they're terrified of losing their funding, and maybe rightfully so.
Supervisor Lemmer, and then I think Supervisor Boots wanted to say something, and Supervisor Krause.
So just regarding some of the funding, I would just respectfully ask you to consider ARPA, because I think planting seeds is not just throwing money, one time. And if it buys us time to get something more stable. The other thing I was wondering is we had that social improvement fund that was gigantic. Some of it was restricted. Maybe some of those restrictions would fit here. I don't know. And a lot of it was unrestricted. What's the status of that? Would that be a possibility to, dip into that cash?
We'd have to look at that, and I respectfully, how you use the ARPA dollars is not a decision for me. That's a decision for the county board. I can look into the any restrictions that might exist for the social improvement fund dollars. Those, based on your existing policies, are going to roll over into capital improvement, all of the funds that were not otherwise encumbered or restricted. So we should have those numbers. In fact, Supervisor Robinson and I were just speaking yesterday, and I have to follow up with Finance Director Cordes to have our, we're in the midst of audit right now, but as soon as we have those trial balances and final numbers, they'll be to the HR Finance and Property Committee as soon as they're available. But I can look into whether or not the general dollars that are unrestricted from the Social Improvement Fund would qualify. And now that I'm saying that, my answer is going to be it depends on what you're going to use them for. So you'd have to, again, understand what the restrictions are, design the program, and design it in a way that the funding would fit. I think, again, and if you're looking for funding, I'm not an expert on Medicaid or CCS dollars. I see Vicky's in the back. CCS is available for a lot of things, but it's not for everything. And the question is, can you align the service delivery to the population in a way that qualifies for CCS? And at some point, someone can be no longer CCS eligible, right? That's a good thing. When they're fully employed and they have their own source for insurance and care, that's great. But to the extent we can maximize those dollars to deliver the services, to get them to the point of self-sufficiency, that too that's success. But I'll look into the social improvement side and the fund balance side.
Supervisor Boots. Thank you.
Yeah, so I just wanted to say, I guess what I would say is we would have to get county board buy-in first. So that's what I was kind of, the comp plan, the strat plan, we used to do a lot better job of saying, okay, here's going to be our priorities. Kind of the same thing we did with opioids 5-6 years ago. This is kind of seems to be the new, I call it the hot topic coming up the pipe, right? And we would have to, I feel, get this in the strat pan, get it as one of our priorities, and kind of work at it that way so that we can get everybody involved that we would need to. But I do believe we need to get the county board buy-in, would be my suggestion on that.
Thank you. Supervisor Krause, did you have something?
In listening to what you're saying, I'm thinking that 2 police officers full-time, that's like 16 hours, 8 hours a day for each one. So if you spend an hour on each difficult homeless person, you would be meeting with 16 homeless, difficult people a day. That seems like an enormous amount of time and money for 2 police officers, because I can't imagine you working with 16 difficult homeless people a day. And I was thinking it would be nice to see another Tracy Rieger. I'm not sure I'm saying her name right, but as a social worker to help with some of the homeless, and maybe one police officer or 2 police officers working half a day each or something like that. It just seems to be too much police enforcement, and I don't see where there would be that much of a problem to require 2 full-time police officers.
Yeah, with all due respect, I would tell you that you need to stop by my office and we'll sit down and I'll push play. And I think your position would change in regards to the 2 police officers. Their day's not going to be based on one interaction with one homeless person per hour. They're there to police the area which is being negatively impacted, and they need to be in a team. And these are individuals that we can't send a social worker into because of the dangerousness and the violence that we're seeing within that population and the carrying of weapons. So I can understand where your position would come from, except that as the leader of a police department, it would be unethical and improper for me to create a team or to send individuals out into our community in the fashion that you're describing. And I truly do invite you, stop by the police department, and I think anyone who's stopped by and we've shown them, here's what's going on, they immediately recognize what that impact on our downtown is. And I tell you this because when our officers are responding to these calls multiple times a day right now, they frequently have to show up 2, 3, 4, 5 officers at a time in order to be able to handle that situation. It's not just one police officer that's going into that call addressing those issues. So the only way I'm going to do that team is if we have 2 officers, but I will wholeheartedly agree with you. The more individuals like Tracy out in the community, they can have more impact. But we're also running into the issue where Tracy can only help people to the degree that resources are available and housing's available, and then keeping them housed. So yes, I disagree with you on the police end, but I agree with you on the Tracy Rieger outreach end.
Chair Gibbs?
Thank you, Madam Chair, and thank Chief and the Mayor for this, enlightenment. Back in 2019, I was able to attend a NACO conference down in Miami-Dade County, and they had an initiative, and still do have an initiative down there, where they addressed their homeless population and their homeless problem that they had seen literally was taking over their beaches and was having impacts on tourism. It was having impacts on their economy. And so they developed a working group that included the business community, included the chamber, included the municipalities, not only Miami, the city of Miami, but Dade County, did exactly what you were alluding to, and that is having a shelter, but then also the need to have the treatment along with the supervision, because ultimately, revolving door and moving people in and out of the the jail facility is not a solution. But so I think what I'm seeing is healthcare. The healthcare industry has to be part of the solution. The business community has to be part of the solution. The municipalities have to be part of the solution. So we need to actually develop what that solution is, because any one entity by itself does not have the resources to be able to sustain, and it's not just Wausau's problem, as some people want to try to paint it. It's a true county problem and an issue, because if it's going to start to affect the business community and the chamber and the vitality of the community, it's going to have an impact on the county long term. So I appreciate the information, and we really need to figure out how we're going to move forward and identify, I think as Administrator Leonard clearly demonstrated, identify the resources and where that funding source is going to be long-term for sustainability, because we can have all the treatment we want, but if we don't have the other part of that, case management and the transitional housing, we're not going to be successful, like you said.
Thank you very much. Just a couple of thoughts that I'm sometimes a slow learner, but things that I have learned over the last several years, as the police department became like the de facto, when there's issues, who do you call? You're either going to call a firefighter or you're going to call a cop, and of course they call us more often. So, sorry, Jeremy. But one thing I learned is every single unhoused individual in this community has their own unique story and history in how they ended up where they're at. And every single individual has their own formula to success. So we can't take a cookie cutter model and just apply it to every individual and be like, well, if we do this, they're going to get better. And so instead of saying, here's this one thing that we can do, and if we do this, we can solve homelessness in Wausau, we need to have a really robust menu of resources that are available for each individual and their individual story and their individual needs. And the other thing that really took a while for me to wrap my head around was individuals that are chronically homeless, they're not thinking about an appointment or a court date 2 weeks from now that they were able to get for a resource. They think in the lens of, what am I doing in the next 15 minutes? And so the way in which their brain is working and thinking about survival and living outside and the issues that they're dealing with is very different than the way we think about things. They're not thinking about what I'm having for dinner in the morning like we might be to take something out of the freezer. They're thinking about, where am I going to be in the next 10 minutes? And so it requires policymakers, as we look for solutions, to recognize those as truths in dealing with this population, because it definitely impacts what those resources should be and how the multiple different opportunities we have to be able to deliver them. And then just one more brief comment. I really like what you had to say, Mr. Gibbs. And the reason I like that is right now, everyone that's impacted as a service provider or law enforcement or the jail, we can get together and we're looking at it through our lens. And I know there has been success when we're dealing with challenges within law enforcement or the jail in asking people, really successful individuals to get together and take the opportunity to look at it through their lens and let us know what we're not seeing. And I think sometimes we can come up with really creative solutions to these complex problems if we get out of our own way. So I'm an advocate for let's get as many people as we can that are concerned about this issue together to help identify what are the city's responsibilities, what are the county's responsibilities, how can we work together. Lots of times someone just looks at a problem for the first time and they're like, well, here's the solution, and I've been looking at it all day long through my own lens and don't see it. So I know the county's been successful in that before, and that might be an additional way we can partner to to help identify those solutions.
Supervisor Hart?
Thank you. So one of the key things I think we need to keep in mind here is that the city has a police department, but not a social services department and not a health and human services department. But that is something that the county has. And I think that's very important for us to keep in mind when we talk about responsibilities. And over the last few years, we've been talking about state mandates that the state requires the county to carry. And one of that is to provide the mental health services, case management. I know for social services, it's geared more towards children, but there is a adult component to that. And I think I heard the chief speak one day. The police department is really dedicating a lot of resources to working with the unhoused population, and that takes away from patrolling the entire community and serving the entire community. So I think we need to look at those responsibilities, and I would like to see the county taking a larger role in providing that human services, because we do have that department. We are part of North Central Healthcare that can help alleviate a lot of these things. Thank you.
All right, was there anybody else that had questions or wanted to provide comments? All right, I did have one question.
Chair.
Oh, yeah. Go ahead, Supervisor Covelli.
Sorry, I had to unmute. I do have a comment and a question. I know that North Central Healthcare defunded Community Corner Clubhouse, and I know Mayor Rosenberg is very familiar with Community Corner Clubhouse. And I do know that Granite House was the offspring of that, and they are now privately funded. You know, there's no public funds involved with Granite House anymore. And they are actually the gap that Chief Barnes was talking about, where somebody needs, somebody that's homeless needs help within 15 minutes or half an hour or an hour or so. I know that Granite House currently is open 3 days a week, and they provide some of that gap that we see where the homeless may need some help with financing or learning how to finance their budget or balance a checkbook or skills-based learning. I know that they provide that type of service. And that's what we found when we did the listening session when North Central Healthcare decided to not fund Community Corner Clubhouse anymore. So that's where that gap exists. I think that if we can find a way to fill that gap and provide those types of services where somebody doesn't have to wait 2 weeks for an appointment for mental health care or substance abuse care or anything like that, those types of programs that Granite House is providing fills those needs. And I think that Chief Barnes, if you could expand on, you said there were 3 different types of groups of people that are homeless, right? And I think the 2 groups you said that you don't typically, I don't know how to phrase it, patrol or have contact with or much contact with, but there is one group that you have a lot of contact with, and those are the troubled group that you run into. If you could expand on maybe a need that you would see that they would need help with, that we could kind of focus on. Maybe there's another gap that we could fill on that side. Thank you.
I'm going to hand this over to the chief in a second, but I like what you're talking about when you're talking about Community Corner Clubhouse and Granite House. Those are psychosocial kind of centers, and it kind of serves maybe a similar population in some ways. It's very low barrier to get help and assistance and community. And I think that's one of the things we at WASA tried to do when we started supporting day services with Catholic Charities. We wanted something low barrier so people could get services. And what we're finding is the population that really, really needs it isn't super interested in going there. But, we're still continuing that effort. But maybe, Chief, if you got something else.
Sure. I think you're spot on with the services that are provided during the day. I don't claim to be an expert in that, but in my experience in Community Corner Clubhouses, that serves individuals with a diagnosed mental health disorder. And I think one of the beauties of that organization is the majority of their clientele might be homeless if it weren't for the services they were providing. When I think of the gap, it is all those services, maybe even a little bit more intense services that are being provided there, but it also has to have a housing component to it. And that's that transitional living with all the supports that Community Corner Clubhouse would provide. And I see that service that the clubhouse provided as being like step 2 or 3, multiple levels of transitional housing where more responsibility is put on individuals, less oversight. And then they just need those supports that are available to them as they need them. And I think a service like that definitely has a place here, and it would be very beneficial. So I'm not sure if I answered your questions there, but I think I agree with everything you're saying.
Yeah, absolutely. And I think that, if the really troubled group that you talked about, that you have constant contact with, what types of services, if we could identify what types of services they would need to help get them over the hump of not being in trouble anymore, and what that would look like, I think that would be beneficial for us to help make decisions.
Yeah, I agree.
Great, thank you. One thing you said earlier, Chief, was about services that empower versus enable people. And I was curious your thoughts on how we as a community get all of the people doing work around this issue to have a similar mindset. So we're working towards something together instead of against each other.
Yeah, I think that at least when I've gone out and spoken to different groups within the community, that it's always interesting when I'm standing there talking to a room full of 40 people, and I know many of them, and I'm like, here's people on the way left, and here's people on the way right. But when we talk about this issue, they all seem to agree that this is a problem. And when I talk about enabling versus empowering resources, I don't see any division there. So that gives me confidence that part of our challenge is, and why I accept every invitation, because the community understanding what the issue is and what the risks to this community long-term are if we don't address it right now, and what that cost might be. Once they learn and they're informed, they're way more engaged, and that'll impact who they donate. We're a very giving community, and a county as a whole. And so I think that you can only provide a resource if it's funded. So whether that's funded through private dollars or public dollars, and I think many people can have a big heart and they see someone panhandling outside Walmart, and all conventional wisdom from individuals who are in the know in this field are like, do not give them money. That is not benefiting them. And that's the way I feel about resources in our community, which is all the resources need to have a component that is helping someone not move miles ahead, but they're moving the ball forward. It might be a couple inches at a time, but it needs to be moving forward toward leaving homelessness or treating their mental health or their addiction. If all it is bringing a sandwich to them in the park or providing them sleeping bags and tents, it's working counter to all the work that's being done by the Parks Department, by the Police Department, by Tracy Rieger. And I think they just need to get educated when it comes to that. And we're probably behind the power curve with our community and our county for sure as a whole, and having them realize that this is a serious issue here, and it's devaluing our community.
If I could add one thing, I think a good strategy there's an opportunity to transition, as Chief Barnes said. There's a lot of people that want to help, and they believe they are helping. We can offer an opportunity if we have a sound strategy that is comprehensive and is built through the process that the chief alluded to before about that collaboration, and this is the way we're going to address this challenge. Where can you plug in to this strategy? I think that's at least a way for them to continue to feel like hey, I'm helping. Because I like the chief alluded to, they're out there believing they're doing good, they're helping people. Because the conventional wisdom too. I was just in the parking lot and driving this weekend and saw panhandling as well. And it's always the challenge. You have the heart and it is conflicting with the mind. Like, I know conventional wisdom don't provide the $5. But let's give the other opportunity for, hey, I know I can help in this other fashion. So I think that's a good strategy to get everyone that is already interested in helping, allow them to plug into that strategy that is built by the community.
This has been a really great conversation. Is there other comments or questions? Supervisor Arstead.
So how do we move forward? That's the big question. Is there, we've talked about all this. How do we move forward? Do we get a task force going with different components of the county? How do you suggest we move forward?
At the risk of saying Supervisor Boots said something really smart here. Of course, I went to high school with him, so I have stories. But I would say that the time that those different city departments and county departments would, and the community would have to invest in how we move forward, it's very valuable. And I think the degree of getting some level of buy-in from the county board to acknowledge that there's probably a role for them to be involved and try and determine what that role is would be energizing to those of us that are going to have to do a lot of work to get that together. And so, like, that would be an ask of my part. I realize we're in a season of change between yesterday and today with elections and who's going to be in what roles. So Sheriff Billup asked me, he's like, is this the right time to come here? I'm like, I'm hoping to get invited back numerous times to numerous different committees. And this is kind of a dress rehearsal for getting feedback from you. And I think there's going to have to be a lot of conversation. There's a likelihood that I might have to come back to talk to, because you guys have a lot of board members, right? So try and reach as many as possible and get some consensus and at least some commitment to investigate that issue before we ask community members and other department heads to spend all that time building that coalition to do that. So at least that's what was in my head.
I'll say you did approve the work plan that had some work for me and my team to start to think about kind of that first concurrent track that I referenced. How can we, in our delivery of service, do a better job of delivering the services to this specific population, given its challenges? I think the chief is spot on with kind of, again, that second concurrent track is if the county board has that consensus, as Supervisor Boots referenced, if there's that collective body says, this is an issue and we need to be at the table. And I like the idea of designating a couple of people from the county board to kind of be the liaisons to that larger group, as the Chair Gibbs and the chief alluded to. You bring in those leaders from the different sectors and those impacted, get them in a room and we talk. And the more we talk, I think it's a good thing. We'll be better educated, better enlightened, and find how we can each of our organizations, the county board, the city council, our various departments, our other municipal departments, our business leaders, the medical community, we can figure out what that recipe is going to be for our community, like it was for Miami-Dade or Houston or any of the other communities. It's going to be a little different for us or Salt Lake, but figure out what that's going to be here. It's certainly not a problem that the city is going to solve on its own or the county. It's going to take a whole lot of hands to move the ball.
Thank you. If there are no other comments or questions, no? Then we will move on with the agenda, but I want to say thank you to the chief and the mayor for engaging us in this conversation today. I think it was very important that county board members and staff hear what's happening in Wausau, especially if you don't live in Wausau. So thank you for your time and coming here today and chatting with us. And thank you for everybody being engaged in this conversation. It was really great to have it with you. So we will be moving on then to item number 8, next meeting date, time, announcements, and future agenda items. Committee members are asked to bring ideas for future discussion, not to me, though. You can send those to somebody else. And 8B would be the next meeting time is Wednesday, May 1st, 2024 at 3 p.m. unless a new board decides otherwise. So with that, do I have a motion to adjourn? Motion by Gonring. Is there a second? By Arstead. All those in favor say aye. Aye. Aye.
Bye.
None opposed. We are adjourned. Thank you.
Hey, thanks for having us.